Hey everyone, welcome. I am absolutely thrilled you're joining us for today's explainer. We are diving into something literally game-changing in the world of mental health, and that's the integration of two incredibly powerful evidence-based trauma therapies. We're going to explore how eye movement desensitization and processing, which we all know as EMDR, and internal family systems, or IFS, can actually be combined to create this wonderfully comprehensive path to healing. So if you've ever been curious about how our minds protect us and how we can safely process deep-seated trauma, well, you are definitely in the right place.
Okay, let's dive right into this. It's a question that clinicians and clients alike face all the time. Why do trauma treatments sometimes just stall? We have these amazingly well-researched protocols, right? Yet sometimes the healing process just hits a total brick wall. And here's the thing, often it's not because the therapy itself is wrong. It's actually because highly defended clients or incredibly strong internal protective parts just step right in. These parts subconsciously halt direct trauma processing for one simple reason. They just don't feel safe yet. And that is exactly the challenge we're unpacking today.
Here is a quick look at our roadmap for the explainer today. We'll start by looking at the complex trauma challenge, move into EMDR and processing traumatic memories, then explore IFS and understanding inner parts. After that, we'll get into the real magic, the synergy of integration, look at 5 principles in practice, and finally wrap up with healing outcomes and impact. All right, starting us off with Section 1, the complex trauma challenge. So when we're dealing with complex trauma, traditional direct processing can sometimes, actually increase a client's resistance. Highly defended clients will often rely on mechanisms like intellectualization, emotional detachment, or just profound avoidance to block standard processing. Now, the absolute key shift in perspective we need here is realizing that these symptoms, like dissociation or avoidance, they aren't the core problem, not at all. They are actually brilliant protective responses that developed like a suit of armor to shield the person from unresolved, overwhelming past experiences. If a therapist tries to just forcefully push through these defenses, the system inevitably locks down even harder. Moving right along to Section 2, EMDR, processing traumatic memories. At the very heart of EMDR is the adaptive information processing, or AIP model. This is the foundational theory here. It basically proposes that psychological symptoms happen when traumatic memories are stored in the brain in a dysfunctionally processed state. Think of it kind of like a file that got corrupted and isolated from the healthy adaptive memory networks that normally help us make sense of the world. What EMDR does is utilize bilateral stimulation, like guided eye movements, to kickstart the brain's natural healing ability. It helps to finally reprocess and integrate those isolated, highly emotionally charged memories right back into the broader, healthy network. Now, what's really interesting about this slide is the sheer structure of EMDR. As detailed in resources like Rodenbrayer's work, shown here, it operates on a very strict, 8-phase protocol. It literally acts like this incredibly efficient engine for healing. When the brain is actually ready and the conditions are just right, EMDR can process trauma with remarkable speed. But remember that whole challenge we just discussed? If a client's protective defenses are highly active, that high-speed engine simply cannot safely leave the garage. Which brings us to Section 3, IFS, understanding inner parts. IFS maps the human psyche in a fundamentally different way. Instead of just looking at a singular mind, it views the mind as a family of distinct subpersonalities. And right at the center of this entire system is what we call self-energy. As defined here, the self is characterized by calm, curiosity, and compassion. IFS posits that this core self is always present and completely undamaged, regardless of how severe a person's trauma history might be. In IFS therapy, the ultimate goal is to access this undamaged core self, so the client can actually relate to their internal parts with compassion, rather than constantly fighting against them. So the crucial point is understanding exactly how this internal system organizes itself around trauma. IFS identifies 3 primary types of parts. First up, we have the exiles. These are the highly vulnerable parts carrying the raw pain, shame, or fear from past trauma. Now, to keep that pain from totally overwhelming the system, protective parts step in. We have our managers, which are proactive. They use things like perfectionism or avoidance to keep those exiles hidden. And then we have our firefighters, which are completely reactive. They swoop in with extreme behaviors like dissociation or rage if that exile pain ever starts to break through. It's so important to remember that all of these protectors developed with really good intentions, basically survival. As Frank Anderson's book Transcending Trauma explores, IFS provides a deeply relational, non-pathologizing map. Instead of viewing things like resistance or dissociation as some sort of clinical failure, IFS views it as a protector simply doing its job. This model completely empowers clients. It allows them to genuinely lead their internal journey using their own inherent wisdom, befriending their defenses instead of constantly warring against them. Let's move into Section 4, the synergy of integration. And this brilliantly illustrates the core dynamic of this integration, which really all comes down to pacing. Think about it. EMDR is explicitly designed to speed up the pace of trauma reprocessing. It's the gas pedal. It's built for acceleration. IFS, on the other hand, is completely designed to slow down the pace. It pumps the brakes to gain explicit consent from those protective manager and firefighter parts we just talked about. By slowing down and engaging the protectors with IFS first, you create the vital internal safety required. And that safety is exactly what makes EMDR's accelerated processing actually possible and sustainable without completely overwhelming the client. Let's walk through how seamlessly IFS maps right onto the established EMDR structure. In phases 1 and 2, preparation, a therapist can use IFS to basically map out the internal system and ask those protective parts, hey, are you worried about doing this work? To genuinely gain their consent. Then, in the assessment phase, instead of just targeting a static memory, the therapist identifies exactly which parts are activated by that specific memory. And crucially, during desensitization, if processing blocks, say a client suddenly feels totally numb, instead of just pushing harder, the therapist pauses. They use IFS to acknowledge the protector that just stepped in, negotiate with it, and kindly ask it to soften. This clears the block without ever overriding the client's internal defenses. Section 5. 5 Principles in Practice. Dr. Daphne Fatter, who is a leading expert in this integrated modality, outlines 5 really foundational principles for making this work. First, recognizing that we all have a self in parts immediately depathologizes the client's entire experience. Second, all parts are welcome. Yes, even the ones causing really difficult symptoms. Third, you must always receive consent from protector parts before jumping into reprocessing. Fourth, the relationship between the client's own self and their parts is innately healing. And fifth, and this is a big one, if parts feel understood, they will soften. Ultimately, these principles ensure that EMDR processing is safely nested within a framework of secure internal attachment and profound self-compassion. Let's move to Section 6 and see how this builds into real healing outcomes and impact.
Consider a real-world case study like Sarah's. Sarah struggled with severe childhood trauma for years. By integrating these methods, her therapist first used IFS to identify the critical protector and exile parts that were shaping her daily reactions. Then, when EMDR processing inevitably became intense, those IFS techniques acted as a bridge, beautifully guiding Sarah back to her compassionate self so she could stay grounded in the room. The result? EMDR successfully diminished the distress of those traumatic memories, while IFS provided the exact internal regulation needed to make that deep processing completely safe.
And the quantitative outcomes are just as compelling as the individual stories. The research clearly highlights measurable, tangible improvements when these therapies are combined. To put that into perspective, one study found that over 61%, well over half, of participants completely no longer met the criteria for PTSD following integrated IFS and EMDR therapy sessions. Clients aren't just reporting a reduction in their symptoms, they're reporting profoundly enhanced emotional resilience, mainly because they aren't just trying to erase bad memories. They are actively healing their internal relationship with themselves. I really want to bring us back to this profound takeaway from Dr. Fatter's principles. If parts feel understood, they will soften. It's so crucial to realize that true, lasting healing from complex trauma doesn't come from fighting our defenses. It doesn't come from white-knuckling through avoidance or forcing ourselves to process memories before we are truly ready. Real healing comes from welcoming our protective parts with genuine curiosity and compassion. So I want to leave you with this thought today. Take a moment and think about your own internal family, your own natural protective instincts. How might your own internal system respond to being deeply understood rather than just overridden? It is a remarkably powerful shift in perspective, and for sure, one that is completely reshaping the landscape of trauma recovery. Thank you so much for joining me for this explainer. Keep learning, keep exploring, and I will see you next time.